Today, Alondra, Nadia, Lydia, JR, and myself will be talking about oral cancer. So first, what is oral cancer? Falling under the category of head and neck cancers, oral cancers are cancers of the mouth, lip, and throat. 3% of all cancers in the US are oral cancers. Cancers of the mouth and throat begin in the squamous cells that line the lips and oral cavity and can spread deeper into the tissue as the cancer grows. Oral cancer is characterized by several different types of symptoms listed below, which all affect the speech and swallowing mechanism. In general, these characteristics can impair articulation and intraoral pressure important for creating speech sounds. For example, problems like tumors on the cheek or partial or whole removal of the tongue, or problems with the lip. This can also create difficulty with mastication and movement of bolus and a host of other problems related to control of the swallowing mechanism and reflex. The first characteristic listed below is white or red patches in the mouth. These white patches are also known as leukoplakia, and while not all instances are cancerous, they are a warning sign. The other symptoms include a sore throat, a lump in the neck, difficulty chewing or swallowing, pain or numbness in the jaw, um, and swelling of the jaw. Many of these symptoms are related to denture use and fitting, which is prevalent among the population that's most likely to get oral cancer, which is those above the age of 50. So issues with the jaw, somebody's dentures may start fitting poorly because their jaw is swelling, so that they would notice that first. These symptoms and the cancer itself are caused by a multitude of factors. So the National Institute of Dental and Craniofacial Research from the NIH includes these causes in order of prevalence. So first is tobacco and alcohol use, and then HPV, human papillomavirus, which is an infection from the sexually transmitted infection. The rest include age, sun exposure, nutrition, and genetics, all to be contributing factors to oral cancer. Tobacco and alcohol use are directly related to leukoplakia, sun exposure directly related to lip cancers. So as you can see, there are a variety of factors that contribute to oral cancer.
Now we will move on to speaking about how oral cancer affects the speech mechanism. Our first point is the impairment in range of movement, strength, and adaptability of the lips, tongue, and soft palate. When these dynamic articulators are affected by issues such as soreness or lumps, it can make precise speech movements difficult. For example, if the lips can't move freely, sounds such as p, b, and can become unclear. Similarly, if the tongue is affected, sounds like t and d can become unclear as well. These problems can lead to problems in speech clarity, especially in connected speech, where smooth and precise articulation is needed. Our second point is pain or difficulty swallowing. A lump or lesion from oral cancer can cause discomfort in the patient's mouth, which makes eating or speaking painful and affecting speech clarity overall. We then addressed how it affects voice quality. When oral cancer particularly affects the tongue or areas near the vocal cords, it can significantly impact the voice, causing hoarseness, raspiness, a quieter voice, a change of pitch. There's been some patients where they've lost their complete voice. Lastly, we address slurred speech. As parts of the oral cavity become restricted, patients may experience slurred speech due to limited movement of the lips, tongue, and other articulators.
So now we're going to talk about disproportionate impact on certain social groups. So as mentioned before, this is particularly prevalent in people who have a history of heavy alcohol and tobacco use, as well as those infected with HPV. Other people who are also likely to be affected are men, people over the age of 50, and people from a lower socioeconomic status. So now I'm going to go into some specifics. So oral cancer cases are 3 times more prevalent in men than women, and all of these stats are going to be based off of 100,000 people. So 20.1 people per 100,000 people in men and 7.2 people per 100,000 in women. So the comparison is 20 versus 7 people. So for every 20 men that get cancer, only 7 women get cancer. And oral cancer is also more prevalent within non-Hispanic whites and non-Hispanic American Indian and Alaskan Natives. So, although this is true for people who get oral cancer, the death rates are a little bit different. So, oral cancer holds a higher death rate among non-Hispanic Black and non-Hispanic white people. The incidence of oral cancer also does increase with age, especially after the age of 50. And oral cancer is most commonly diagnosed between the ages of 55 and 64. So people from a lower socioeconomic status are considered at a higher risk for oral cancer due to a variety of factors, but most specifically oral health care. They often don't have as much access as somebody from a higher socioeconomic status, and it oftentimes results in late treatment and a late diagnosis. So, people from a lower socioeconomic status are also linked to poor diet, limited health literacy, and higher rates of alcohol and tobacco consumption.
So now we will be looking at interdisciplinary team involved. Dentists and doctors are usually the first people to notice if something is wrong. So when they see signs of oral cancer, they would do what's called a biopsy, which is when they take a sample of tissue taken to be tested for cancer. And sometimes they would use saliva instead of tissue for the biopsy. And if cancer is found, the patient slash client would be informed of what choices are available to them. And depending on what they choose and what they need, their team could consist of different professionals. So some professionals that may be involved are otolaryngologists or ENT, who are involved with diseases in the head or neck, oral and maxillofacial surgeons, which are dental surgeons, and oncologists, who specialize in cancer treatment. And depending on what treatment type they choose, they could be working with different types of oncologists. So, a radiation oncologist, for example, works with radiation therapy, whereas a medical oncologist works with chemotherapy, immunotherapy, and targeted therapy. And they could also work with plastic surgeons to reconstruct slash repair certain parts of their body. And the role of SLPs is to assess speech functioning before cancer treatment, to counsel and monitor swallowing and speech function during or after treatment, and they may collaborate with plastic surgeons to repair certain parts of the oral cavity.
Okay, so moving on to clinical and research considerations. When creating a treatment plan for a patient with oral cancer as a clinician, it's very important to consider the stage and location of the tumor. So whether or not the tumor has spread to other parts of the body, as well as where the tumor originated. Um, and we also must consider the patient's age, overall health, and risk factors, the prognosis of the type and stage of oral cancer that they have been diagnosed with, and also the potential impact of treatment on functions like speech, swallowing, and chewing, as these are very important functions, and things like speech results can be a factor in post-operative satisfaction, personal satisfaction. Additionally, it is important to consider treatment and their side effects in conjunction with the patient's age, overall health, and risk factors. We also should consider the patient's treatment goals, as we always want to provide patient-centered care, where the patient's preferences, goals, and values are at the forefront of all decisions made by the interdisciplinary team that is working with them. And something to also consider is a second opinion from a healthcare professional. So as of right now, the three main treatments of oral cancer include surgery, chemotherapy, and radiation. And surgery options may vary depending on where the tumor is located, as well as how much the tumor has affected the integrity of the oral structures. Other treatment options include targeted therapy, which uses antibodies to block the replication of cancer cells, immunotherapy, which utilizes the immune system to fight off oral cancer, and also complementary or alternative methods, which may include vitamins, herbs, or other non-traditional treatments like acupuncture, although it is very important for the patient and the team to be in communication about which complementary or alternative methods that they may be implementing into their lifestyle, just so that it doesn't interfere with any effects of the treatment. In terms of speech rehabilitation, exercises such as oral facilitative exercises, direct articulation techniques, and compensatory strategies may be prescribed after surgery to improve articulation and facial muscle strength. The American Cancer Society also recommends supplemental or support services to aid the individual, for example, maybe emotionally or physically or religiously, as this diagnosis often has effects that last beyond the physical body. And these are our references.